Good morning, good afternoon, good evening, wherever you are. So today I wanted to talk to you about interpreters within healthcare facilities. I'm Dr. Akrasabag, an interventional gastroenterologist, and I thought this was really important because sometimes we get patients who may not speak English, at least in the US, and might apply to other countries depending on what your primary language is. And most of the facilities I've worked at, we usually have an interpreter. So an interpreter is somewhat different from translator, even though you might hear us use those words interchangeably, because the interpreter is for the spoken language. And so when we have an interpreter, some patients can actually say no, meaning they don't want an interpreter. Instead, they want their family or their friend to interpret for them. And there's some challenges with that. Sometimes the person who's interpreting for you may not necessarily understand the language as well, or they may not necessarily understand the terminology as well. What I would want to assure those who are requesting for someone else to interpret for them, or those who are doing the interpreting, is that the conversation is confidential. Your information is not shared outside the confines of that healthcare facility. I think that's sometimes a concern. And of course, it's understandable that a patient might be more comfortable with their family member or their friend, but it's always important to think about the terminology. Whatever will be explained to you, would that person be able to adequately explain? Or you as interpreter listening to me, do you think you're in a position where you can adequately explain whatever is going on and provide the patient with the right choices? Sometimes the interpretation is not exact. Some things might be left out. I think it's sometimes a concern. Things are not well explained. I think also when we request for an interpreter, it's important to realize that you have to be specific in terms of the language. So for example, if we say we want a Portuguese speaking interpreter, it's like Portuguese from Brazil versus Portuguese from Portugal. Those are different. Or even in Arabic, I've also learned that we have to be specific by region in terms of whom we want to serve as an interpreter. So my main thing is to realize if you're the one who's doing the interpretation, the conversation is definitely private. Please feel free to make the most of your healthcare institution interpreters. Obviously, you're more than welcome to sit there and listen as they interpret for your family, for your friends, and you can trust that the conversation will remain confidential. Hopefully that's helpful. Thank you.